It's interesting because the pain and the itch fibers are related in the skin. And because there are sensory nerve fibers that have cannabinoid receptors in the skin and throughout the immune system, even on the hair follicles, they can be influenced by either our own cannabinoid, which is called anandamide that we make, or a topical cream, a cannabinoid that works. And they've even done studies in patients with itching from end-stage renal disease, which is very severe and intractable, hard to get rid of. And they found that 38% had a complete cessation of their itching, which is almost unheard of in that population. Then there was another study done, and 83% of the patients had no more itching with severe chronic itching, prurigo, lichen simplex, which had been intractable up to that point. And that's with a topical CBD cream with a high enough concentration that it's actually effective. It's like a whole new industry. It's unbelievable. I've spoken at about 8 medical cannabis conferences around the country and also in Canada. And it's amazing, all the science, new science going into it, and so much we have to yet discover about which cannabinoids help in which diseases. There are actually over 130 cannabinoids, and CBD is just one of them, but it's one of the ones that we've discovered is the most prominent so far. But there's CBG, CBN, and many other cannabinoids, as well as THC, which does have psychoactive properties, but in a small amount in combination with the CBD sometimes activates the CBD. And we have so much to understand because this is also a very personalized medicine, cannabinoids. People react very differently depending on their metabolism and how they absorb things to different terpenes in the cannabis sativa plant and different cannabinoids. So not only have we got a lot to discover on all of the cannabinoids and all of the terpenes in the cannabis sativa plant and which ones would work for which diseases, there's also an element of personalized medicine and which one would work for each person individually. So there's several big researchers across the country who are collecting databases on a patient's experience on which combination of CBD, CBG, or different amounts of THC or THCA works for them in their disease. So it's going to be combined with a lot of data in order to try to figure this out. And there's also many medical and scientific analyses now beginning. When I took care of wounds in the past, it's so painful. You would have to, you cut out the dead area, and it's so painful for the patients, and they're so hard to cure. Very difficult. But as far as the wounds go, there was one case study done with 3 patients who had terrible wounds from pyoderma gangrenosum, terrible pain, and the topical cannabinoid actually reduced the pain and helped with the proliferation of skin cells, of new cells, and helped the wounds shrink. And the patients were able to reduce their opioids, all 3 of them. And there's many, many anecdotal reports, but this was a double-blind study recently in the literature, and I'm really hopeful that a lot more research will be allowed to be done, and we'll have so many more studies as soon as the government becomes more scientifically based.